Life is filled with struggles. Some are harder than others. We are constantly fighting on and growing with every minute passing by. But sometimes the fight is too big to handle, leaving the mind in a deep spiral of misery from a life that once had. It only takes a single moment to damage one's life, leaving the past behind, leaving the future unreachable. This happens when that one moment holds the present hostage, leaving the victim unable to move forward in life. A constant reminder of this darkness that is laborious to keep in check. These events of aggression soon become a disease, a disorder, a symptom of larger emotional issues known as post-traumatic stress disorder, better known as PTSD. Once viewed by society and the medical field to be a minor problem to those affected by PTSD, viewing these patients as weak minded individuals is just recently being viewed as a serious mental illness. This mental illness is caused by a life threatening or severely traumatic event or experience. People most commonly associate PTSD to only those who serve in the military. Anyone who had the unfortunate reality of going through combat experience, terrorist attacks, natural disasters, serious accidents, assault or abuse, and emotional losses are very likely to be diagnosed with PTSD. Out of the 223.4 million individuals in the USA that have experienced a traumatic event, 44.7 million of those individuals will develop PTSD. PTSD is like a dark, shaded rainbow of emotions. It comes with an array of symptoms that overlap with depression and anxiety attacks. Having all of these symptoms is overwhelming, and finding the right type of treatment and coping skills to live a manageable life is hard, as there are many ways for an individual to deal with their traumatic experience that are more harmful than good. There are about three different types of therapies most commonly used: cognitive therapy, exposure therapy, and this is a tongue twister, eye movement desensitization, and reprocessing, also known as EMDR. Figuring out what treatment is best for the general population of individuals with PTSD will be very beneficial in helping one get immediate and reliable help in the new journey that they'll be taking place. Cognitive therapy helps you rethink the ways of thinking through cognitive patterns that are keeping you stuck. Cognitive means the mental action or process of acquiring knowledge and understanding through thought, experiences, and senses. Cognitive therapy focuses on critical rationalization. Patients are encouraged to create hypotheses on their beliefs on the world, their futures, and on themselves. This process helps with reducing emotional distress. Cognitive therapy is focused on not eliminating those negative emotions, but rather setting reasonable and thinking more realistic as they move forward. Exposure therapy helps a PTSD patient safely face both their traumatic situation and emotions in an effective way to learn how to cope. Individuals with PTSD frequently hold erroneous beliefs that recalling the trauma memory is dangerous or harmful, leading patients to believe that they will go crazy or lose control. Exposure therapy is designed to help patients rethink, redesign their memory to gain a new perspective on their trauma while distinguishing between thinking about the trauma and re experiencing the trauma. Eye movement, or I should say EMDR, is a brain based standardized psychotherapy that utilizes BLS, which is bilateral stimulation, a very scientific word, to relatively affect distress, reduce psychological arousal, and reformulate negative self stigma. Using a blend of multi-sensor images to identify the traumatic memory with pinpoint accuracy, patients are able to understand and combat their experiences in meaningful ways. PTSD is a diverse illness with many shades of gray. At face value, PTSD is just another way of saying you're extremely troubled or depressed, but that is far from the truth. As our understanding and recognition of PTSD grows, the healthier and easier it is to see and diagnose yourself. There are options, some big and small, but you're not alone and you need not fear. You will become you because there's help out there for you. You just gotta reach out and get it. You are not alone in these trying times.